Hi everyone. So, I have a bit of a story to tell you. About 2 years ago, a little bit less, I wound up getting hospitalized very briefly with severe abdominal pain. Didn't know what was causing it, and I got a CT scan taken of my abdomen. So, first thing, I'm fine. No problems were found. And I just got my bill for the insurance on this, which was a lot less paid than I expected. So I'm going to turn lemons into lemonade and take you guys through the CT scan of my abdomen and get some good out of my eventual medical bill pain, which will be a pain in the butt. But don't worry, I'll be okay. It's just more money than I wanted to spend. But enough of my complaining. Let's move into examining how to read cross-sectional anatomy in the coronal, and then a separate video will be generated for the sagittal view and for the axial or horizontal view. So we're going to start anteriorly here and move our way posteriorly and check out some of the major landmarks of three-dimensional anatomy when we take those structures and put them into two-dimensional slices. So, we get started. Just a bit of abdominal fat there. I'm working on it. And nice big opening for the umbilicus there. And we move a little further in. We're catching some musculature here. That's the rectus abdominis muscles. And right away, I'm starting to see my costal cartilages and xiphoid process meeting up with the inferior side of my sternum. Now, since this is an abdominal CT, we're not going to see a whole lot of the thorax, sadly. But right here, we can already see the liver poking through as we go into the body. And I got a big gas bubble here. So gas bubbles are going to be indicative of the GI tract. So the stomach, various parts of the intestines are definitely going to have some gas bubbles in them. And since I was going to the hospital for severe abdominal pain, I wouldn't be shocked if there's going to be a lot of that as we work through it. One cool thing here is my costal cartilages appear to have some areas of ossification happening. That tends to happen with age, so I guess I am not immune. And we've got some ossification happening here where they're coming into close contact with one another. So we'll go a little further posterior, and we're getting to the ribs now. And the musculature of the body walls peeling away. We get more visibility of the liver right there, and we got quite a bit of the GI tract visible already. Now, I've toured through this series of images a few times already, and I know this is my transverse colon, but we'll go over why it's my transverse colon as we go through this process of viewing these images. So here on this first pass, I want you to note that we've got the diaphragm separating the nice big liver on my right side, extending over to the left here from my thoracic area. There's the heart, and if we do a little quick view here, we can actually have it give us a little bit better view of the lungs, and their characteristics right there up in the thorax. But since we don't have much more of the thorax available for view, we'll skip back to this setting and go a little further in. So here's the liver and the stomach. So notice the stomach's a nice big structure here. It's pretty anterior, at least, because it shows up right away as we move from anterior to posterior. And going further in, you can see my pyloric sphincter right there. It's a nice view of the terminal end of my stomach becoming the first portion, the superior duodenum right there. And here, if we keep an eye over here, we're eventually going to see the esophagus traveling up that way. But we're not in that slice yet. Still more transverse colon here. We keep going a little further posterior. And here is my gallbladder. We're going to see it kind of lay down a little bit more posteriorly and to the left as we go, but it's located right there, so I still have my gallbladder, and I intend to keep it that way. On the outside of the body wall, we're getting to see a little bit of the distinction between the different layers of the abdominal muscles, the external abdominal oblique, internal abdominal oblique, and in my case, a relatively thin transversus abdominis muscle. So we'll pay attention to those as we keep on rolling through. But here, we have the stomach, esophagus will be coming in. Here's the duodenum and gallbladder. Let's take a look at how those change as we keep marching a little more posteriorly. Gallbladder is getting a little more central. Stomach's fundus is becoming a little more prominent up here. And the duodenum, right here, is going to start migrating posteriorly and associating with the head of the pancreas. That's where this choppy material right here is. Now, we got a lot of vessels coming into the equation right here, but I'm going to back up just a bit, because the small intestines are pretty much all of this looped, slightly gray, with a little bit of gas bubble kind of structure right here. So we can see the small intestines are kind of laying out. In general, the jejunum tends to be more prominent up here in the upper left quadrant, and the ileum more in the inferior right quadrant. And we can actually see the vascular markings of the superior mesenteric artery traveling to that organ. So we can follow those vessels all the way back to their origin and just see how they're supplying this organ right here. That is the small intestine made up of the jejunum and the ileum. Here, let's take a moment and check out the stomach. I'm going to roll a little more posteriorly, and right there is my esophagus. So let's watch that transition again. It's going to poke through the diaphragm, and right about here it's going into my stomach, forming the cardiac region of my stomach. Not super clear, but it is happening right there. Fundus of the stomach here, and let's roll back anteriorly. Watch my stomach descend. Whoa, going anteriorly right there, and my pyloric sphincter just here leading to the duodenum. Now let's follow that GI tract as far as we can. So the duodenum's superior portion here is going to stretch to the right, but also dive posteriorly. So let's watch that lumen as we go a little more posteriorly, and it's going to start migrating inferiorly right about here. Here's the head of the pancreas, and if I go a little further in, there's the second or descending portion of the duodenum. This is where the common bile duct and main pancreatic duct, as well as an accessory pancreatic duct, may be emptying. Now that makes sense, since my biliary tree is not super clear here, but it would be coming off my gallbladder, traveling down here. There's the gallbladder, as well as the bile canals coming from the liver itself. But the pancreas sits in that concavity. So here's the descending duodenum, and then the inferior portion of the duodenum here, its third part, and the head of the pancreas is hanging out right here. Now we're going to take a short diversion and follow the pancreas a little bit posteriorly. So here's its head, and we're just going to see if we can follow any of that organ around. It's a little tough to spot. So pancreatic tissue here, here. Now what's funny is I'm seeing it kind of right here as it approaches the spleen. There's the tail of my pancreas, but I'm actually having a tough time finding the body of the pancreas that connects the two. So it's kind of hanging out here, bridging those structures. So let's jump back to the GI tract. So here's the descending second part of the duodenum, the inferior or third part of the duodenum, and to create the jejunum, it's got to make a quick jump superiorly into its fourth part and then make a U-turn to become the jejunum, but it also has to travel anteriorly to do that, since the jejunum has a significant mesentery holding it to the body wall. So we're going to go from here and march anteriorly, and right there, really nicely, we can see the ascending duodenum meeting up with the jejunum, and then jejunum is just going to be all the loops of bowel that I'm seeing in this area. It's very gradually going to migrate down, around, and end up transitioning into the ileum, which will then drop the bolus of digested food into my cecum and ascending colon. Now right here is my cecum. Let's see if we can catch it very early on. So the cecum's right here. Now my appendix, as far as I know, is still in there, but I'm not seeing it on this view. I'd expect to see it maybe a little bit posterior to here. Sometimes they lay out in the body. Sometimes they lay posterior along the body wall. But the cecum receives this bolus of food, which we'll now call fecal material, because it's going to be turning into poo very soon, and goes into the ascending colon, which transitions to become the transverse colon right about here at the hepatic flexure, or the right colic flexure. So let's see if we can get a good view of that transition right here. Now, one other special thing about the transverse colon is it has a mesentery, so it actually hangs off the posterior body wall and can have a variety of appearances as a result of that. So here, if we follow the large intestine, the colon here, we see it move a bit anteriorly, and it's actually going to loop down. Mine has a pretty significant swoop to it there. There's the swoosh of it. Don't tell the people at Nike, but there's my transverse colon. And it's moving from the right side to the left side. And here at the splenic flexure, on the left side, we have the left colic flexure, aka splenic flexure. And that is going to drop fecal material into the descending colon. Now here, that transition's happening right about there. We'll roll a little bit posterior. Here's some more of the descending colon, but we can't see the connection between here and there in this slice. We'll go a little further, follow it down. The transition's happening. We go a bit further in, and the descending colon will go along the posterior side of the body on the left. So it's going down through here. Let me see if I can pick it back up again. This one's a little tough to spot, but right there. And it's going to make it down into the pelvis eventually, but first it's going to form the sigmoid colon. So I'm going to actually cheat a little bit and pick it up right here. This is it, coming out of the plane. So it kind of dives around. And here, descending colon is going to pick up another mesentery and become the sigmoid colon. So we're going to see this lumen kind of skip in and out of the image as we go a little further along. So there it is. Right there, we got some continuity, but then we got to roll back posteriorly to follow this part a little bit more. Part of reading these 2D images and constructing three-dimensionality of it is following it one direction and then following it at another. So here's the sigmoid colon, and it's about to take a turn south or inferiorly and become the rectum. Now right here we got my urinary bladder right there, moderately full, and iliac crest up here, iliac bone here, head of my femur here. But let's get back to that sigmoid colon. Right about here, it's going to turn south, and there we go. At the juncture right about here, it's going to form the rectum, and it's diving in and out of the screen a little bit here too. So there's the rectum, very clearly connected right there. And we come back here, rectum, full of gas. Again, I was in abdominal discomfort, so no shock there. Sometimes fecal material is very visible. That's what some of this choppy stuff is. And then some gas there. And we go a little further down, and right there, we're catching a bit of my prostate. It's on the right at the base of my bladder here. So there's the prostate coming in. But one thing that's real nice is we've got this nice little dark gray stripe coming off my pelvis on either side and going around the rectum. That's the levator ani muscle. And that's the reason that this gas material is staying inside my body at the moment. I had this taken. It's because that muscle was contracted and it kept the external anal sphincter closed. Now while we're here, we'll just keep going a little further and catch the swoop of the gluteus maximus muscles there. Here's my sacrum. Disappears and out. So we'll run back in a little bit here. So there's my coccyx, tailbone, right there. And the actual anal opening would be down here, although we can see some of the rectum in this section right there. The actual anal opening would be right here, but again, musculature's holding it tight. So we've covered the GI tract. Let's hit one or two organs that we've not drawn explicit attention to yet. We're going to run back anteriorly. Here's the liver, stomach, pyloric region. And here, on the left, we're going to get an organ. Starts out pretty small, but it's more prominent on the posterior lateral left side, and that's going to be the spleen. It's roughly the same consistency as the liver, and we can see it taking up a lot of space posteriorly right there. And as we go a little further along, we catch the left and right kidneys. So the left and right kidneys are there, and they're going to give off the ureter. And right here, I want to try to follow the ureter as far inferiorly as I can. So right here, the ureter is coming off of the renal pelvis, takes a turn inferiorly right there. We'll just try to follow that little dot further down. Man, that is tough to do though. So following those ureters can be a little bit of a challenge, but they will eventually enter the posterior side of the bladder and release urine there. So we've done the organs. Now let's take a look at the blood vessels. We've seen some of the blood vessels here and here going to the organs, but let's take a look at where they're coming from. So we're going to go to the posterior body wall, find our vertebra. So here's my thoracic lumbar vertebra right there. It's my nice big psoas major muscle flanking it. As we go a bit more anterior, on the left side we're going to see the aorta, the descending aorta, come into play. So it's right here, and we'll follow it down. Because of the lumbar lordosis, I actually have to go a little bit more anterior. It bows anteriorly a little bit as it travels down. So my aorta is right there, and here it's splitting into a left and a right common iliac artery. Likewise, my inferior vena cava is right nearby. Blood from the left and right inferior iliac veins are converging to create the inferior vena cava, which is traveling on my right side, up through here, and it's going to pass posterior to my liver, receive some hepatic veins. You can actually see a little shadow of that right there, before it drops into the right atrium of the heart, right there as it passes through the diaphragm. So let's see if we can spot a few specific vessels on here. So here we've got some big arteries traveling to the spleen and the liver off the celiac trunk, right here. I think we've got the celiac trunks. Actually, let me correct myself on that. That is almost certainly the hepatic portal vein right here, coming from the splenic vein and the superior mesenteric vein. So right there, we can see the hepatic vein traveling into the liver right at its porta hepatis. We'll have biliary ducts leaving the liver at the same point, and the proper hepatic artery splitting into right and left hepatic arteries nearby. So that's actually part of the portal system, which is super cool. But let's jump back and see if we can spot some of the vessels off the aorta. So here's the aorta. Two of the easy ones are the right and left renal arteries heading towards the kidneys. That's nice. We've also got the renal veins right here, moving into the inferior vena cava. And we go a little further down. This is pretty cool. We just happened to catch my left testicular artery. That little stripe right there is the guy. So that's the left testicular artery. If we travel down, and we have to go pretty far anterior to see this, but that artery is traveling down, and it's going to have to pass through my body wall to actually get to the scrotum. So right there, those are the testicular artery and vein, these little dots surrounded by the indicator right there. And we go a little more anterior, and right there they're going to pass through my deep inguinal ring, through the superficial inguinal ring, down, 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 becoming the spermatic cord and making it into the scrotum. But we don't have a clear view of that since this is an abdominal CT, not a pelvic CT, so that's the end of that little exploration. Here, jumping back up, we can see the small intestine, jejunum and ileum, and the superior mesenteric artery gives off branches to it. And let's follow those back and see if we can spot it. Here's the superior mesenteric vein joining the splenic vein to become the portal hepatic vein, but parallel to it is the artery. So here's the superior mesenteric artery. Let's follow it a little further back, and right here is where it's coming off the aorta. So just to the left of my indicator, that's superior mesenteric artery. This is almost certainly celiac trunk or celiac artery right there. And there they are coming off the aorta. It's pretty subtle, pretty quick, but that's what's happening right there. Splenic artery, common hepatic artery, and left gastric artery will come off this guy right there. And superior mesenteric artery is going to supply all the midgut, so the distal duodenum and pancreas, the jejunum, ileum, cecum, appendix, ascending colon, transverse colon, all of those organs are getting their blood supply from the superior mesenteric artery here as it gives off these branches and just scatters throughout the midgut. I haven't been able to spot a good example of the inferior mesenteric artery in any of these other sections, but we do have it here, just before the aorta bifurcates, right there is the inferior mesenteric artery, and we're not going to be able to follow it too far, but it's supplying a superior rectal artery. It's traveling inferiorly right down there, going on the anterior and posterior sides of the rectum. It also will give off some sigmoid branches that are kind of scattering right there to the sigmoid colon, and a left colic artery, which I'm having no real luck following, but it's going to supply the descending colon back along here. And I don't see any big vessels coming into him. So here, vertebral bodies, and we've got a nice view here actually of the crus of the diaphragm coming down as it's wrapping around the top of the spleen on the left, the liver on the right, and we've got the right crura and left crura of the diaphragm here, and the aorta transitioning between the two very far posteriorly at the median arcuate ligament. And here we can actually see that separation between the external abdominal oblique muscle, internal abdominal oblique muscle, and the relatively thin, at least in my case, transversus abdominis muscle right there. Now, while I was going through this, I just made one little weird discovery about my own anatomy, and I want you guys to bear with me now, or you can just press stop if you don't feel like indulging me. But here, I found out to all appearances, I have a third floating rib. Instead of ribs 12, 11 being the floaters, it looks to me like I have 11, 12, 11, and 10 being my floating ribs. So right here, got my T12 vertebra. There's the lowest rib. It's right there. Here's T11, T10. So we'll follow these guys a bit anteriorly. So they're coming off. Here's T12. We'll follow it anteriorly right there, dwindling and gone. Over here he's hanging out a little bit longer on my left side, but gone. So T12, floating rib, just like we'd expect. Here's T11. We keep going a little more anteriorly, also dwindling, 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 and gone. Likewise here. Here's T10. We'd expect T10 to wind up attaching to the costal arch, but right here on the right, it's transitioning into cartilage pretty quickly. Right here on the left, that's happening too. But that cartilage just goes away. It doesn't really seem to ever meet up with my next most superior rib, number 9. But if we follow it, we can see that it's definitely meeting up right there with rib 8, rib 7, and going into my costal arch. So, weird little thing about me. Okay, I've run out of other things to draw to your attention in this video, so I hope it's been insightful and you get a little bit clearer view of how to interpret and follow the three-dimensional anatomy through a series of two-dimensional slides. Thank you very much, and I'll see you at the subsequent videos.